Good morning and welcome to KAUS Live. My name is Michelle Ponto and I'm part of the KAUS Communications team. I'm here today with a special guest. His name is Dr. Andrew Bastawrous. He is based in the UK and he's an eye surgeon, a public health doctor, and the co-founder and CEO of Peak, a social enterprise that is changing the way the world sees. Welcome to our show today.
Thank you.
So as I mentioned, you are based out of the UK, but you don't spend much of your time there. Where are you doing a lot of your work?
Most of the work started in Kenya, so we still have a lot of the work based there, but it's also now spread to being in Botswana, which has one of our largest programs, and also India, and various other places around the world where research is going on.
And this is eye research that you are conducting. And what exactly are you doing in these countries? What are you doing with the people there?
So there's a huge number of people, around 36 million worldwide, who are blind, and almost 4 in every 5 are unnecessarily blind. The work we're doing is to try and identify those people and make sure that they're accessing services. And we use public health methods, mobile technology, to try and connect the service providers with those who are most in need of treatment.
Okay, you mentioned so many people have eye problems that are going blind. Why is this?
The majority of those who are blind, so around half, are from a condition known as cataract, which is just a aging change of the lens inside the eye where it starts to go cloudy. Anyone that lives long enough will eventually develop cataract, but in developed health systems you get access to treatment very early. But if you live in a remote area such as a rural part of Kenya, then you may never receive treatment.
Okay. So your job is not to do the eye surgery, but to identify the people who have it, who do need it, and help them to get the help that they need before it's too late. Yeah,
exactly. There's so few specialist eye care workers. So, for example, in the UK we have around 3,600 eye surgeons. In Kenya there's less than 100 for a population of a similar size. So you can imagine that there's a huge demand on the services. And so it's really important that we help the services to build up slowly, but also to ensure that those who are not accessing services are able to bridge that gap.
How did you get into this? What made you think, I'm going to go down to Kenya and Botswana and treat people?
I had a fairly pivotal moment when I was 12 years old where my mother insisted I go for an eye exam, and whilst I was there the optician looked very surprised to see how poorly I was doing on the test, and then she fitted me with a pair of glasses and said, just go and stand outside and tell me what you see. And I remember standing at the door and looking up at the trees and just being shocked that they had leaves on them that I could see in detail. And I realised in that moment I'd been missing so much of the world for years and had no idea. That night I went home and I saw stars properly for the first time. So there'd been a whole world that I wasn't aware that I was missing, and that's part of the problem. Is when you grow up not seeing, you don't know that you can't see. And for me it changed my life completely in terms of the opportunity, how I started performing at school, socially I started to interact much better with my peers. And I was aware that had I been born somewhere else, something so simple as a pair of glasses, which have been around for 700 years, wouldn't have been possible. And that just felt wrong, and an injustice I've been focused on doing something about ever since.
Wow, that is a very inspiring story. For the people that you are treating, does the cataracts come on gradually, or is it like you, where they didn't even realize they had a big problem until it's been identified?
So the majority of people with cataract tend to be over 50, but it does, in most cases, happen quite slowly. And the mindset for most people is that there is no treatment. It's accepted that with age you lose your sight. The problem is when you lose your sight, you lose your independence, you often lose your dignity, and it often means somebody else who has to care for that person loses their normal life. So it's often a child taken out of school to look after an older parent or grandparent. And so when there's the accepted belief that blindness is a given, people won't seek treatment, and that's obviously a problem.
You mentioned one of the challenges of working in the area is there isn't equipment that can do these kind of tests that will identify the problem. And you actually came up with a portable solution to remedy this. Tell me a little bit about the tool that you developed.
So whilst I was living in Kenya, I was there doing a PhD through the London School of Hygiene and Tropical Medicine, and my job was to establish 100 temporary eye clinics across the Rift Valley and in those eye clinics I had all the state-of-the-art equipment. But it was incredibly difficult getting that equipment to the places that we needed. So 2 in every 3 clinics had no electricity. Most of them had very poor road access or no road access, which meant us having to carry lots of heavy, delicate equipment. And then we needed a large team of specialists to be able to do the tests. And the reality is, outside of a research program, that is not a practical solution. So I used the opportunity being out in those settings to start creating some mobile technology. Some great people came on board to support with their skills to make mobile apps and hardware that could go on a phone, with a remit that we wanted non-specialists to be able to do these tests using a smartphone-enabled device, and be able to take it on foot to places that we couldn't get to.
Okay, so it could be used by, like you said, non-specialists, so you don't have to be an eye surgeon to be able to use your app. And what happens once people say I use it, and does it save the information and that you can bring that back to someplace, or does it pop out an instant diagnosis?
So the way it works is, before we start going and identifying people, we do a situational analysis where we'll look and estimate how many people in this population do we estimate to have a problem, and who are the service providers and where are they. Because one thing we don't want to do is create a huge surge of demand for services that don't exist. So once we've done the planning phase, what we do is we train people. And I'll give you an example of our first program, which was doing school screening in Kenya, where teachers were trained to do the screening, because previously nurses were leaving the hospital, going to the school, where around 1 in every 20 children, so around 5%, would have a vision problem. But it meant most of the nurses' time, who was already under huge amounts of work pressure, was spent seeing the normal children. So what we did is train the teachers to do the screening, and they would do the vision test on the mobile app. If they found a child who couldn't see, it would notify the hospital in real time that that child had been found. It sends an SMS to the parent, explaining to the parent that their child's been found with a vision problem, what they need to do. And it also creates a simulation on the screen, helping the teacher to understand the visual world of the child. So in the same way, as a child, I didn't know that I couldn't see, neither did my teachers. So this is an opportunity to instantly engage the teacher so they understand the visual world of that child. So that way everyone involved in that child's care is aware of the problem and what needs doing, because ultimately the child doesn't know and the teacher isn't the decision maker. So we need to influence the parent and make sure the hospital knows that person's coming. So we effectively create a connected care pathway.
Okay. For this connected care pathway, do people actually follow through? Like, if the parent does get the SMS, do they bring them to the hospital, and does the hospital, is it, in these countries, is it expensive to get this kind of surgery, or is it covered? How does it work?
So the first time we deployed that system in Kenya, we did it as a trial, and we had a control arm where they weren't using the mobile app, but they had the standard card-based vision test, and they were written a referral note. And in the peak arm, they went through what I just described, and 3 times the number of children turned up at the hospital when using peak compared to the standard. But that was still just under half of them overall not attending. So we still hadn't done as much as we want. We'd gone from 21% attendance to 54%. So the next system we deployed added a second layer in between, which was, for those who'd been identified, we sent someone to the school for those 5%, rather than expecting all the 5% to go. And we managed to increase it then to over 95% getting followed up and treated.
Oh, that's excellent. So you're a doctor. This is an app.
Yeah.
So there's a little bit of different of a skill set on creating an app from medicine. How did you come from thinking we need something to this actually being developed?
I suppose throughout I've always been focused on the issue. So why are we doing this? And my first thought was that I needed to become an eye surgeon to help fix this problem. And then I realised that being an eye surgeon, I was only going to be able to do a little piece of it, so I then became a public health doctor and researcher. And in that process, I learned a huge amount in terms of the difference between managing an individual versus a population. But then I also realised that if it was confined to research and publishing papers and sharing best knowledge, that wasn't actually going to lead to implementation. And so it was through a combination of those factors that I was speaking to various people saying, look, this is an issue. I don't have the expertise to make the hardware or the software, but I have the ideas of how they could work. And some really good people came on board, pro bono, shared their time and expertise to help build the prototype apps and devices. And then from there, it's gone on to now become a social enterprise. We have 20 people on the team, and the programs are starting to scale. So we now have a business as well that is running and deploying this, hopefully globally in time.
Okay. I'm going to ask you a little bit more about the app and getting it developed, because there are a lot of our people who are watching are entrepreneurs, or they have great ideas, but they don't know how to get their idea out to solve a problem. Mm-hmm. And you actually found a way. How long did it take, and how many trial and errors did it take in between to get the app to where it is today and working in a way that you are happy with?
I wouldn't be able to tell you the number because it's so high, but I think we work on a principle of continuous improvement, so I don't think it will ever be finished. And actually the app is just a small component of the whole system, so I feel like it's one of the vertical components that can be used for a test, but the test has limited value if it's not connected in the pathway. So I think having always been conscious of all of the barriers to people receiving treatment and looking across them holistically, we've tried to come up with the various pieces that, when connected, work. And I think there's a lot of good people out there who want to use their skills for good, and I think when they can see a strong case that their work will contribute to something, then good people come on board. And I'm extremely lucky to be working with a team that is in peak now. Some highly talented people who could choose to work in other sectors that are more highly paid, but believe in what we're doing, and I think that's why we're going to succeed.
It seems like your journey has been constantly evolving, starting with just visiting people, doing it the manual way, now having the app. How many years has this taken, just from you going out and slowly building in this whole process of getting it from start to finish? So
I first drew out the concept and wrote a kind of short article about it in 2010. So it's been 7 years from, I suppose, idea to reality. And I think it always feels like we're not where we should be, that we should be much further ahead. I think as soon as you develop something that starts to work, you realise the potential to positively affect more people is even bigger, and so your aspirations grow. So you never really get to a point where you feel like you've finished or that you're where you want to be. Your ambitions grow, and the desire to reach more people expands constantly.
Do you find you need to be flexible based on which country or which area you're working in, based on how the hospitals are communicating with the schools, or how culture is in different areas?
Yeah, it's really important. So I'd like to think that we're uncompromising and totally flexible, which means that we have to always go in and not propose the solution, but propose the questions, which means really saying what are the barriers, as opposed to saying these are the barriers. And once we've identified the barriers, asking the local teams, how do you propose we overcome these? They have to be locally owned, local ideas, because ultimately it will be people on the ground who are most directly affected by this who will ensure that those solutions work. So we're constantly actually learning from the ground, and effectively we facilitate that process. Okay,
which leads me to my next question. It's obviously working when you're there. When you leave, does the local team continue so that there's always this care that's happening?
Yeah, when I leave, it gets better.
It gets better?
Yeah, which I don't know whether it's because the program's good or because of what I'm doing. But it's always been built in that success is succession. And so if any of it is dependent on me or on the core team, then what we're building is not sustainable. So to date, we've had really good examples of the team's local initiative to overcome problems that we hadn't even seen, and a demand for it to grow and expand beyond us. So, very recently we had a great meeting in Botswana where the team from Kenya and Rwanda were also visiting, and just the three country teams were able to share all their experiences and learn from each other and come up with new ideas. And moments like that are very fulfilling to see that this is really starting to move in a positive direction.
Okay. I was reading that right now the app is free. What is your vision for Peak?
So our ultimate vision is that vision and health is available for everyone worldwide, and we're doing that through various things. So we have a free app, which is the vision test, but our focus is on what we call Peak Solutions, which is the entire end-to-end pathway. So from going into a place to determine what the need is for that population, plus what the services are and what the gap is, and then designing the program to fill that gap, and then supporting implementing that program, which builds in monitoring and evaluation as part of the process. We then always do a follow-up to make sure that we learn the lessons, because there's always mistakes and there's always lessons to be learned, but making sure that we build that in to the next phase of scale-up. And that really is our entire process, which uses our apps and sometimes uses the hardware, but they're actually small components of the bigger picture. And so really our vision is that the methods that we're using encourage continuous improvement wherever anyone is working. So we're now working with some really good NGOs who between them work in over 60 countries. So we just started a partnership with CBM, who are the biggest disability charity in the world, who are currently based in around 65 countries. So next year we'll work together in at least 4, with a plan to expand beyond that. So really now taking our process and working with partners who already have relationships on the ground, and establishing it in the places they're working to support the impact that they're already making.
Okay, yeah, that was going to be my next question. How do people find out about you, and how do you get into these countries? So you kind of explained that with the charities, and this will help enable that you don't need to be every single place at every single time if these people are taking it forward.
I mean, there are so many good people in this sector who've been doing work for a very long time, and you know, a huge piece of the work is building relationships and trust on the ground, and it takes time to do that. And we feel like there isn't enough time to get to all the people who are waiting unnecessarily blind. So by partnering with people who've already built those relationships and supporting them to go further, to reach more people, to improve the quality of the services that they're offering, that enables us to deliver our impact through those partners.
Okay. What kind of challenges did you face when developing even the whole process that you're working on?
I suppose there's been challenges from how do we make the whole process sustainable, how do we pay for it. It was a project, it was not a legal entity, we had no funding, so it's been for a long time it was begging and borrowing to get things working, to prove that they worked. Then in 2014 an amazing backer, the Queen Elizabeth Diamond Jubilee Trust, came and gave us significant funding to move it forward. And they've been a phenomenal partner ever since. So not only have they provided us with most of our financial support, but also they've given us all sorts of support in terms of opening doors to have opportunities at the World Health Assembly to speak to multiple governments about the process. And that has really been catalytic in us getting to where we are, because they looked at the problem we were trying to solve and we were totally aligned on that, and they weren't fixated with the very specifics of how you do it. And that's one of the biggest barriers in this sector, is that you tend to have to know what you're going to do before you do it, and the reality is no one's plan ever is exactly as they do it. And so their flexibility to support us to grow as an organisation and to learn for ourselves and overcome the problems as we face them has meant that we've been able to succeed.
Okay, so you had to do a lot of, well, you had to wear a lot of different hats. So you were thinking about solving the problem of how can I fix these vision issues that are happening, but at the same time you had to solve funding problems. You had to figure out how to make an app when you're not a techie. You had a lot of different things that you had to overcome in order to get to where you are today. What advice would you give to inspiring entrepreneurs like yourself who want to make a difference in the world, and they just don't know where to start?
I'd say if there is something that you care enough about, just decide if you're going to do it, not how you're going to do it. If you get lost in how, then you'll never do it. It's the same as, I'm very fortunate to be a father of 2 and have a third on the way, and if I had to work out how I was going to be a parent before having a child, I would never have had a child. But once you accept if you're going to be a parent, you work out as you go. You believe that it's important enough and of value that you'll do whatever it takes to make it work, and you learn as you go. So it's a lot of people are afraid that they don't know the detail or how it's going to happen or what the consequences are going to be. I'd just say if you care enough about it, just jump in and work it out when you're there.
Okay, perfect. That's all the time we have for today. Thank you very much. This was a really great conversation, and I'm gonna look more follow you on your app and see what's going on and see how you guys are changing and see where you're going next. Thank you very much.
Thanks.